What's the best anabolic TRT dose for muscle growth?
So, as you know, as a doctor, it's a difficult one to just sort of answer without being like crucified by your colleagues. So, what I say is our job is to get your levels safe, and the rest is up to you. That doesn't mean. So some people, they'll see a health practitioner and they get their level just 1 point above the minimum and are told they're fine, and then their symptoms are ignored. That's definitely not my approach. I definitely aim for the upper third of the normal limit, keeping an eye on things like your hematocrit and stuff like that as well. So obviously safety is a concern, but we want it as high as possible, giving the maximum symptom relief, but also being safe. That's paramount. In terms of muscle growth, the rest of it's down to your own lifestyle. Are you eating right? Are you training right? Are you doing all these things sensibly? And then I don't see any reason that if your testosterone's normal, you can't gain a significant amount of muscle mass. You can get extremely big by just training right and eating right. And I think looking for a high number for performance enhancing and things like that, the safety issues far outweigh those benefits long term.